Okay, I am here with Dr. Ann Lingg, and I was hoping that Dr. Lingg, you could tell us a little bit about yourself.
Thanks, Carrie. I'm glad to do that. My name is Dr. Ann Lingg. I'm a psychotherapist, and I have a private practice, and the majority of my practice is working with children. I received my training as a psychotherapist. My PhD is in counseling and psychology from the University of North Texas. So I graduated in 1990 and started my private practice in 97. So it's been doing it a long time. In addition to that training, I've had extensive training in play therapy and how to work with children in counseling and what approach works with them best.
Great. So do you think that play therapy is beneficial for any age, or are there specific ages that it is more helpful for?
Play therapy is beneficial for kids basically about 2.5, 3 to up to about 10. That's probably the target age for play therapy. Although children that are a little older benefit from the play therapy room as well, depending on it, because they may be emotionally younger than their chronological age. So it works very well for that. But also I've even done teenagers in the play therapy room doing sand tray therapy, which is very helpful. So, but the target area really for play therapy is about age 3 to 10, somewhere in that neighborhood.
Got it. What are the different types of play therapy besides like the sand play that you do?
Well, a basic play therapy room is set up with very specific toys that allow for children to express whatever it is they need to express, because the beauty of play therapy is that kids don't have to be real verbal. They communicate through play, and so the toys are their words. That's how they can communicate with me. They might not know why they're feeling a certain way, but I can make inference or observation by what they're choosing, how the characters might be interacting, what the puppets are saying, what's going on in a sand tray story, and I can understand a child's point of view that way. So the toys, like I said, are chosen very specifically. There are several different categories. There's nurturing, aggressive, creative, real life toys, and scary toys. There's 5 categories. And each one of those categories have very specific toys within that category. And it really does allow for a wide range of expression of whatever the child is feeling or thinking or going through. So
I've witnessed it myself, and it is very beautiful to see.
It's a beautiful approach with children, and it's effective, and you just can't do talk therapy with kids.
Play is their language.
Exactly. Yeah. And that's where their comfort level is too.
Yeah.
Is playing. And so they're having a blast, they're having fun, and don't realize how much they're really getting out of it until they're feeling better or their behavior changes or,
Absolutely.
So, yeah.
How do you help kids who are grieving, specifically the loss of their sibling?
Grieving, children grieve differently than adults. They have a very small window of ability to tolerate emotional pain. So it allows them to go in and out of their grieving while they're in the playroom. Like I explained to parents, they might talk about their sibling who's died and then ask for lunch or go play, or, and depending on how old they are, their understanding of death, they might talk about the child who died and then said, well, is Bobby going to come for lunch? What's Bobby going to have for lunch? Or, something like that, because they don't understand the permanence. So there's a swing there in terms of what their understanding is. But because children grieve differently, the play therapy is so appropriate, and it's a safe place. And they can, maybe an animal dies in the playroom, that something happened to it, and we can talk about the animal's death, toy animal, not a real one, but we can talk about that death and what their family members might be thinking and seeing. So it's one step removed from their emotional vulnerability at the
Yeah.
time, because they
Yeah.
can't always talk about it. So they can play it out in the playroom.
Yeah. So since we're living in times that are different than most, how are you providing services during COVID?
Well, I was pretty much closed down for a little while, but right now, I'm seeing clients in the playroom. We wear masks. If they feel comfortable without wearing a mask, I'm okay with that too. I have stayed very sequestered, so I feel very safe. I've never had any symptoms. So, but they come and they play, and we still are socially distant in the playroom. Occasionally, you get a little closer, but working with such young children, that I don't feel threatened by them, and what they might be carrying or whatever. But also, I've taken to cleaning my own playroom. I've called off the cleaning service in the building. I've put in 30 minutes between clients so I can clean toys, whatever have been used right then. I have the ever lingering smell of Lysol in my office. So I've taken every precaution possible.
Definitely.
Yeah, you must wear we're required to wear masks when you come into the building. But once you're in my office, if you have a comfort level without it, it's fine. It's a little difficult to, for the child to see your face, which is really important, or rather my face. They look for responses from me. I look for responses for them. But I have some that don't have that comfort level, and I'm perfectly fine with that.
Definitely. And then also, would you like to share why you would like to be a part of Love Like Jackson, the foundation that we have?
I would love to share that. And the way I became informed about Love Like Jackson is working with Jackson's brother, as you know, Ivan. I believe so strongly in counseling for children, and because they often get lost when a sibling dies, or a grandpa or mom or dad, or close friend. There's so much grief in the parents and in the people close to them that children often get overlooked, and it can affect them for a very, very long time, all the rest of their life, if their grief is not resolved. So I think grieving children need counseling, and I would very much like to be a part of that, because I do believe in it so strongly. So a death for any reason is important for children to have availability for counseling.
And we have seen the results of early intervention and regular counseling with you, with Ivan. I mean, it's been, for me, a miracle to experience, because there was a time where I felt like this was going to be impossible. And through your guidance with Ivan, as well as with me, you've given me reassurance that I can do this, that we can do this, I don't believe that we're done with counseling. I think it will probably be a lifelong thing for Ivan. But he's had the ability to share, and he's learning how to put his feelings to words, and that we do recognize his grief also. And so we're very thankful to you for that.
Oh, you're very welcome. He's a delight, but you're right. It's not a lifelong process, and meaning you're going to be in it for 15 years, but periodically, at different stages, there might be certain triggers that you need tune-ups. And you brought up something really important too, which is when I work with children, which is, I think, the way everybody should work with children, is you have to work with the parents as well.
Yeah.
And that allows me to help parents with strategies, what to expect, is what they're seeing with their child normal or not normal. And so that allows the child to benefit even more because their parents getting some guidance as well.
Absolutely. All right. Well, thank you so much, Dr. Lingg.
You're welcome. Good luck.
Thank you.